Kathy from the United States who has rheumatoid arthritis. Welcome, Kathy.
Good morning, Linda, and thank you for having me. I'm so excited to tell you about my experience with Low Dose Naltrexone, better known as LDN. Absolutely no one here had heard of it, and neither had I. I wouldn't have had a need to hear about it, other than I had a very, and I use the word had, a very aggressive form of rheumatoid arthritis. I sought help, having absolutely no idea if I was dying or I had no idea what was wrong with me. All I knew is that I was going to die if I didn't get some help.
How old were you, Kathy?
I was 58 years old, and I'm now going to be 61. So about 2.5 years ago. And I had experienced aches and pains my whole life, but I'd never experienced anything like this. It ripped me apart from my heart and my core. So I went into the doctor. The general physician didn't know what to do with me, and he said, "You need to see a rheumatologist." And I'm thinking, oh, you've got to be kidding. Just give me something and fix me. I want to go home and live again. I went to the rheumatologist. My SED rate, my original SED rate that they took on me was 97. And all I know is they told me it was off the charts, and my rheumatoid factors were high. I didn't know what to do. I couldn't walk without the assistance of a walker. I couldn't go to the bathroom because I couldn't sit down on the toilet. And I know this sounds strange, but if I went to the bathroom, how was I going to wipe myself? And how was I going to get back up off the toilet? I did not know. And there was no way I could put clothes on. Every joint in my body, and it seemed to move from one to the other, to the other, to the other, to the other. So I was put on methotrexate and massive doses of prednisone, 50 milligrams a day. It was really bad. I did not know what to do. And I was on massive doses of hydrocodone, or Vicodin. And, of course, I got sick from every single one of them. So it just compounded the problem and an insult to injury. The long and short of it is the methotrexate did not work with me. I'm very sensitive. I reacted. The only thing that worked was the prednisone. And that, again, was massive doses. And I would waver anywhere between 20 milligrams a day and 50 milligrams a day. So then I was moved to a drug called Areva. The generic name for that is leflunomide. Oh, and on the methotrexate, let me go back. On the methotrexate, most people are given in pill form 10 milligrams per week. I was on 20 milligrams per week, and it still wasn't making a difference. So then I was moved to Areva, or the generic name is leflunomide. That made me sick as well. It was horrible, horrible stuff. Again, massive doses of prednisone, massive doses of hydrocodone, throw in massive doses of compazine to try and keep my stomach down. Again, the only thing that worked was the prednisone. Now, for about 18 months, I could not move. It was horrible. I love my rheumatologist. She was doing what she knew. I couldn't have sat at the computer and used my hands if I wanted to. I could barely pick up a cup to drink. And I can't even imagine myself. They wanted to deem me permanently disabled. I was that bad. And I couldn't believe it because I don't settle for that term, permanently disabled. And I'm a very, very, very active person. After that, and I wish I could give you dates on when this all happened. At the time, about all I could have given you was the date of my death at that time. I wasn't keeping records, but I suppose I could probably find out. Anyway, I sought out a second opinion for a rheumatologist. And my first rheumatologist, Dr. Virginia Wilson, I still have her, but I really, really was seeking out Dr. Daniel Malone. He was considered one of the top in the country and forward-thinking where fibromyalgia went, and he was a rheumatologist. I tried to get a hold of him originally, and I was in so much pain I never gave it another thought, but it would have taken me 6 months. My husband saw an article in the newspaper, and I'll be doggone if he wasn't coming to our little town to practice. And I think I was the first one on the phone to say, sign me up for him. Mm-hmm. I went in and met with him. I was very, very impressed. Very impressed. He seemed rather, a little arrogant fella and just kind of a little odd man, and I loved him. He was just my kind of guy. But he listened to me. And not that Dr. Wilson didn't, but she was afraid to go outside the normal parameters of treatment. So anyway, I didn't know about LDN yet. Dr. Malone put me on 40 milligrams of Humira every 2 weeks, along with the prednisone, and he was not happy about me taking loslunomide, nor was he happy about me taking so much prednisone. He said that those are the two most dangerous drugs there are. Not that prednisone isn't good in its place. He has a real hate for loslunomide. So anyway, and it was destroying me. So I went on Areva once a shot, a 40 milligram shot every 2 weeks. They moved it up to once a week because it obviously wasn't working. It was proven that none of the standard medications worked on me. Mm-hmm. My next course of action was to be T-cell blockers. And most RA patients don't get to that point. They generally do find something that's somewhat effective for them. Absolutely nothing worked with me. And an old high school acquaintance looked me up, and we were chit-chatting, and I said, she asked how I was, and I asked how she was, and she has this medical problem. I had that medical problem. It was quite obvious we'd gotten to be older folks. And she told me about LDN, and since knowing her as a child, her sister had RA, and it was a very, very, very sad case, and she said she wished she would have found this for her sister. So I said, please send me any information you have and let me do some research. And that's when I joined GOT-E and the Rheumatoid Arthritis group at yahoo.com, and the support was phenomenal because I had no idea other people had this. Mm-hmm. I'd heard of it, but how do you ever find those people? You aren't capable of going after them. Anyway, long and short of it, when I first took my LDN, and my little Dr. Malone was absolutely brilliant. I took him in the LDNscience.org website printed out, and my blood pressure was 168 over 110 that day. I was so pumped. He said, whoa, your blood pressure's high. And I said, I've got something for you that you aren't going to like. That man listened to me. He looked over those papers, and he goes, this cannot hurt you. He said, let's give it a try because you have nothing to lose. And that, I believe, was on March, I believe, of 2010, so not quite a year ago. I had a couple stomach cramps from taking this. I did allow the other drugs to clear out of my system for 5 or 6 weeks. So I started out with no drugs in my system, although loslunomide has a half-life of 2 years, so there is a drug called cholesterol that'll flush it out of your system. I opted not to do that. It's a pretty rugged drug from what I hear. So I'm carrying around residual effects of that, but it is not impacting anything. Mm-hmm. LDN, I had a couple stomach cramps. Everybody said, oh, you're going to be up all night. Well, I sleep like a baby. I got a little numbness in my arms for a couple weeks, and I did the standard RA protocol, 1.5 milligrams for 30 days. Then you move up to 3 milligrams, and you can take that for 30 days, or if you do well on it, you can move up to 4.5 milligrams, which is the RA therapeutic dose. I've never had problems with it, but I'm telling you what, I've had success. I go out, I ride my horses every day, I unload 2,000 pounds of feed and bedding, and we cut hay, and I throw hay bales, and I go out and I shovel snow, and I was vaulting on a horse a couple weeks ago. I have aches and pains. I'm 60 years old. I mean, if LDN can make me 20 years old, I will be gladly accepting of that. There is nothing I can't do. And I would say it took about 3 months for it to be effective. And I'm not saying everyone would be that effective, but I can see absolutely no reason that a person shouldn't try it and not permit the toxins to go into their system. My rheumatologists, both of them, which I both see Dr. Wilson and Dr. Malone, have used the term RA burnout. And they have never, ever seen it happen in anyone until the damage is so extensive that there is no quality of life left. So who knows if that's a technical diagnosis or not, but we cannot find it in me any longer. I had shoulder surgery 2 weeks ago. They got an inside look at my shoulders, which my shoulders used to be so affected I couldn't raise my arms. There is no arthritis in there. Nobody knows why I'm like I am. And the only thing differently that I do is take LDN, and I faithfully take 4.5 milligrams every night. And I will take it for the rest of my life. And it just, I don't know where I would be without it. I don't know what would have happened to my family without it. My husband basically ended up staying home taking care of me because I couldn't function. You have nothing to lose. You have nothing to lose and everything to gain. However, there are circumstances where people feel that it's not successful for them and another drug is, but we are all chemically unique, and for me, this was the perfect storm. I've never regretted it, and I never will.
I understand you saw your rheumatologist yesterday. What did he say?
I'm sorry, what was that?
You said that you saw your rheumatologist yesterday?
I saw him the day before, and not for rheumatoid arthritis, and it's funny because we discussed that. I said, well, I suppose you won't want to see me in March for my one-year checkup for my RA. He goes, yes, I'd like to keep an eye on you. And he started laughing. He said, but I do like to do my yearly on my RA patients that are so improved, to which there are not many. The visit that I had with him was strictly my shoulder visit. I have a bone spur, which is causing damage to the rotator cuff and the tendon. That was the reason for the visit. And he said, when I need my prescription filled, just call him up. And he and I have some fun discussions. Oh, I will tell you this. Now, I do not know if this has actually happened. My original rheumatologist, I still see her, and I've insisted on the two of them working together, even though they are from different organizations. And my first rheumatologist, Dr. Wilson, who was skeptical, has fibromyalgia. The last I talked to her, about 6 months